So in leadership and governance, pharmacists take part in public health policies development. They provide new form of healthcare to promote health. Either they simply treating diseases. So our next scope is medical products, vaccine and terminologies. Medical product. From medical product we can say that it demands special knowledge with regard to use and risk. It promotes learning of new skills and new activities for better health promotion, provide and effective services to patient and client through communication skills. So at the time of vaccination, there are a lot of pharmacists present at the venue of vaccination providing there the help for the provision of the vaccine to the normal person, normal people of the society, and they need a special skill and improved knowledge of all the stuff that is the vaccine, the technologies, the terms, the medicine products for provide the effective health care to the people. And next is health services. First of all, as we all know, the main function of pharmacist is to dispense medicines. The main function of pharmacist is to read the prescription first of all, and by reading the prescription, they dispense the medicine to the patient, and they explain the patient that they must take it twice a day, once a day. The precautions, for example, the patient should not take tetracycline antibiotic with milk. Why? Because it to form complex with the milk, the Ca plus ions of the milk, and it form a complex, and the complex is not easy to remove from the body in form of any like fecal, urine, sweat. It does not excrete out from the body easily. So the main function of pharmacist is to say the precautions also, is to prescribe, is to read the prescription, dispense the medicine, and help the patient to acknowledge the medicine very easily. So for it, the communication skills must be present in pharmacist. For example, if a patient does not understand that what he or she should do with the medicine after the 5-time explanation of the pharmacist, then pharmacist must be easily and with patience explain the 6th time also. Then, sir, ma'am, you should take the medicine like this way. You must follow the precautions like this way. So the communication must be present, and a good communication skills must be present in a pharmacist for betterment of the health services. So communication skills, medicine expert pharmacist should call response as a stability to deliver effective, safe and quality medicine and services to achieve optimum health. Now the last topic our scope now is health workforce. That is, pharmacists are responsible to patient need and professional performance. Pharmacist making must involve patient in healthcare decision making process should grow greatly. Okay. Now we should move forward for the last topic of today's, that is role of pharmacist. So, our next topic for today is role of pharmacist in social pharmacy. Pharmacists do play a crucial role, a very important role, and irreplaceable role in a social pharmacy in a day-to-day life. Some roles can be elaborated. We can get it into a short by the term IENC. For it, I stands for information. Now E stands for
education. Communication.
So, we can elaborate the role of pharmacist by simply explaining these three terms. First of all, let's come to the I section. I stand for information. What kind of information pharmacist must deliver to the persons? Pharmacist must deliver information like what's ongoing in their surrounding, what's ongoing new in the medical world, what are the new informations, what are the new drugs that are introduced in the society, what are the new doctors available nearby them, what are the new kind of diseases that must be spread in their area, what are the precautions persons must be take to prevent from the diseases, what are the policies that must be made for them to understand their diseases pattern easily. And when we come to the education, second one is education. E stand for education. Education does not mean sitting them and provide them a degree. That is not the education that is provided by pharmacist to the person. Education means that the pharmacist must tell person about the disease ongoing there, educate them to prevent from the disease, educate them to pay attention towards their health, educate them to prevent from the superstitions present in the village level. Okay, and last one is our communication. What does communication mean? If a pharmacist does not have a good communication skill, they must not be present in a society, because if a pharmacist has soft voice and communication skills, then only person will be able to understand their level of understanding and their work. So they develop health education policies and programs. They conduct disease prevention and central programs. They involve in population-based research and central programs. They particulate in drug policies and development criteria for formulation. They help in drug distribution system. They educate all healthcare services about medical stuff. They run healthcare programs. So thank you so much. That's all for today.